I think the challenges for NHS England are almost unlimited. There's an exceptionally difficult job that we have to do, and we have to look, I think, for the whole of the future decade to try to bring about the transformation that the NHS quite clearly does require. And it requires that for a number of different reasons. I think one of them is that there's no healthcare system in the developed world that's currently sustainable on future levels of demand, and the NHS is clearly one of those. Secondly, I think we've really got opportunities. We have, I think, a choice to make around models of care that focus exclusively on patients. And I think this is the moment in the history of the NHS when we can start to refocus on that as our driving ambition. I'm really pleased that the Confederation has come out not just with a report in its own name, but jointly with National Voices and with the Academy of the Royal Medical Colleges, because I think the only way forward is through an alliance of clinicians and patients co-creating an NHS for the future and working around our traditional models of care to try to find new ways of providing a continuity of care that meets patients' desires and wishes and preferences, rather than perhaps too often in the past a model of care that suits those who provide it. I think a major problem for the health service is if the Francis report gets buried, drops out of sight and is forgotten, because there's one thing that's certain, is that those issues will come up again in the future, and we'll once again be worrying about what went wrong. We at NHS England have put Francis' report right at the heart of everything that we do, and that's expressed by putting patients at the heart of the system. Francis is the starting point and the wake-up call for a very significant change in culture in the way in which we as the NHS as a whole envisage our relationship with patients. I think public confidence in the health service is shaken but not destroyed. To develop that sense of confidence further, I think requires attention on a number of fronts. I mean, putting patients at the heart of it is clearly issue number one. Secondly, one of the things that gives patients confidence in the health service is access. And actually, in terms of access, the NHS scores pretty well internationally. I think thirdly is the quality of care that patients get, and a sense that the NHS is still performing amongst the best systems in the world. And that is, again, something which we believe requires further investment and further focus, not just on care, but also on prevention and on self-care, so that patients who come into the NHS have a sense of what it can do for them, but also what they can do for themselves.